Hi everyone. Today we're going to talk about managing fatigue and multiple sclerosis. Fatigue affects many patients with multiple sclerosis. It is said that up to 80% of people with multiple sclerosis can have some degree of fatigue. And today we're going to talk about common ways to treat and manage this fatigue in multiple sclerosis. Fatigue can be an early manifestation, an early presentation of multiple sclerosis, or it could come later on in the disease life cycle. It does not have to do with how severe your MS is or not. It can happen in people with mild MS, it can happen in people with more severe MS. But generally, patients with MS tend to feel drained. They feel as if they are only able to do certain tasks during the day, and after they do one or two tasks, that their energy is drained. This can start at the beginning of the day, so some patients would wake up fatigued, but most commonly, the patients actually get fatigued as the day progresses. Patients generally feel as if they are like an old cell phone with a drained battery. They just cannot hold the charge long enough. They can do one or two tasks and then would have to rest and take a break. And in my own mind, I separate the fatigue into three major types of fatigue. The first one is just a motor issue. Sometimes fatigue can affect your muscles. You could get tired and sore and stiff, and therefore you can't really walk around as much as you like. It can be a central brain reason for it, where the brain itself is unable to produce enough energy for you. Or it can be a psychological issue, like depression and decreased drive, or it can be a combination of the above. So how do you manage all this? Make sure that you mention this to your doctor so your neurologist can talk to you about the subtype of fatigue that you have. But generally, the first thing you have to do is prioritize your to-do list. So you have to put the first things first. The thing that you have to do in the morning that's most important to you should be the first thing done. For example, if you have to go to the bank to sign some paperwork, and also you have to go work on your garden, you might feel that the bank visit is more important than the gardening that day, so you have to place that early in the morning. So if you went to the bank and got back home and you felt tired, you can take the nap and then do the gardening, or you can actually scrap the gardening altogether and get rid of less important tasks. The second way to treat your fatigue is to take breaks during the day. Just like we mentioned, the fact that cell phones have to be charged. If they are old enough, you have to go back home and work and take a little break, even sleep a little bit, take a little nap, just recharge your energy basically. The third way to treat your fatigue is to hydrate well, and of course you have to ask your neurologist whether hydration is okay for you depending on your bladder situation with multiple sclerosis. That's a question you have to ask your neurologist. You have to have generally good and well-balanced nutrition. You should ask your neurologist also about any particular exercise that you're allowed to do. Generally, moderate exercise is recommended in patients with multiple sclerosis to attack their fatigue. Think about cooling your body, drinking cool liquids. High temperature is known to cause more fatigue in MS patients, so make sure you're cooling your body with cold drinks and air-conditioned environment. And lastly, there are certain medications that you can use for fatigue and multiple sclerosis. We'll have that discussed in a separate topic, but of course you have to address that with your neurologist. So stay tuned with us. You can follow us at angelsneuro.com, or you can subscribe to this free YouTube channel, and we'll have more videos for you soon. Have a great day.